With our national death toll now rising by roughly 1,000 Americans.
Those cases add to the more than 8,900
Every
total
veteran
positive.
and guest will be screened when they enter
The hospital is being able to
VA.
take care of severe COVID patients.
It's a leader's job to give hope. And I was very worried about that because this was an unknown.
All of us were going, this is going to go everywhere. And so when it made it to Europe, and then it made it to New York, and then it made it to Colorado, it became very, very real.
Things got real for us on March 9th because that was the first day we admitted our first COVID positive patient. It was just interesting being on the other side of the aisle, so to speak, being the guy saying who can come in, who can't see their loved ones at end of life, and knowing that personally I was experiencing that too. So.
Boy, I don't know. This is so resource intense. I don't know how we can keep this up for, a week.
The supply chain at that time was unavailable.
I love history, right? So you have the great debate, do events create great heroes or do great heroes create events?
Okay, how can we reuse our PPE and what will work best, and can we use UV lights? And again, it was just so many things that came out all at once, and you were just grasping for anything to try to make sure that our staff and our patients and everyone else was safe.
People are going to get sick and people are going to die, and that's on us.
Is the staff prepared? Do we have the right equipment? Do we have the right supplies? Or do we have the right people in the right positions? Do we have the resources that we need to deal with this?
There wasn't a single person that I thought we could do without, really. I mean, that's what you cannot prepare yourself for.
These are people's lives. It's a life, every life. And that's all I could think about.
There was a period of time there where every day there was a message going out, and there were messages based in fact as we knew it, as we understood it that day.
And if we don't need to use them for isolation, then we don't, but we plan for isolation.
Right. For all the phases.
Mm-hmm. For all the phases.
Yes.
I think we were one of the few facilities that actually did a manpower pool. Now that means everybody all in on the manpower pool, and then we tasked from the manpower pool. That included physicians, nurses, finance folks, everybody was on the manpower pool.
I've always believed that a hospital, when it's functioning at its best, is during a crisis. But this was a crisis unlike any I have faced in my 38 years.
I could put myself in their shoes. I am a nurse, and nursing defines how I make decisions and how I do things. So I'm pretty proud of that. I think the best thing you can do is to be transparent. Even though some people probably didn't think I was, I felt an obligation for our employees to know what I knew.
The only way we were going to get through this pandemic was take each day at a time, brick by brick. These are hard decisions, and we have your back.
You have to keep going yourself. I lived at the hospital. I slept more on the floor in my office than I did at home for a period of time. And I think you have to go out and you have to visit people and you have to show that you're in it with them.
I was exhausted, as was everyone else. But you just keep getting through it because you're searching for the light at the end of the tunnel.
I've been working my whole career to be the number one, to run the hospital, to run the organization. I never got it on active duty, but I got it here in the VA. And so during this pandemic, I'm the number one. So this all, at the end of the day, falls on me. So, hey, here is your chance, Paul, to shine and to lead this group of 1,100 people, okay, and flip and storm the hill and take it. I didn't get that in the Army. I got it in the VA.
I need to know what's happening at each site with our veterans. I need to know what's the need per each site. What supplies do they need? What equipment do they need? So just tracking all of that. And there wasn't a standard way to get this information, so they had to be creative.
It was clear it was a commitment to how do I care for my veteran, whether you're in the EMS worker or you're one of our surgeons, all in between. The staff knew that to take care of our veterans, we got to take care of each other and take care of the facility to make it a safe place to provide that care.
I don't think it's any secret that there's a divide in any environment, and so I think trying to find some way for employees to come together and unify even with their differences. The strength of our democracy is that people can have their own points of view, and we wanted to respect that, and at the same time we had to protect those that felt so unsafe and insecure.
We took employees who had mental health jobs, and they were suddenly out in blizzards screening employees in the dark, in the cold, and every time I was out there, because I live on station, so I drive through at night. I would drive through in the cold, in the rain, in the dark, and they were like, if this is what I've got to do, it's what I've got to do.
Command, Sergeant Major Dick Venedal. Rest in peace.
I actually had to get involved. I spent many nights there, and I think personally for me that what hit home was when the staff was so stretched thin that I actually had to be the one that had to carry all the veterans that had passed away to the morgue.
They're soldiers, they're sailors, they're airmen, Marines. They have been through tough times, okay? And when this thing hit, it's another tough time. But those people are resilient.
We'll also have you see our physical therapist, since you're talking about feeling kind of a lot of this weakness.
You can work when you're scared. You can work through fear. You can work, you can be resilient. You can put that face on and you can still take care of veterans.
We had nurses, we had other members of facility leadership teams and staff sit with them and spend those last hours with them, pray with them. Those are the stories that probably mean the most to me, because I always think about what if that was my mom or my dad, and you know, you always want to live by the golden rule.
And you don't want them to just become another number, but there were so many people and everything was so busy all the time that it was, you had to almost stop and not think about it, because it would just, I mean, you would just want to curl up and just feel bad for everybody. I think when you get into healthcare and you get into a position of leadership, you want to go in and save the world, and then sometimes you just can't.
You're always sort of watching the troops and how the troops are doing. Our mental health resources that we have that are on board are really for our veterans. And so now we're in a mental health situation where we need to provide mental health for our staff.
I think employees were both traumatized personally and professionally. Professionally, as a doctor or a nurse, what they would struggle with was, I don't know what the answers were. They would constantly be on their phones looking to see, how do I treat this? What do I do? How do I get through this? How do I be somebody's savior?
I want to know what's going on. I know I'm not out there in the field, but I know a lot of things about the VA, and we want to try to make sure that we focus on your needs. We all were going through a lot, but they went through the most. I haven't ever done this, but I mean, it's been a hard year.
I think what this pandemic showed is that VA care is superior. And it's superior because of the continuity of care the understanding of the patient population base. Our employees know our veterans, they care for our veterans, they love our veterans.
Reaffirmation for our mission, because you can't go through what we went through if you're not committed to that. We need to take a break and take that breath and just really reflect on what we've been through. You know, mourn what we need to mourn and celebrate what we need to celebrate, coordinating the best package of care and services for each veteran based on their needs, whether that's with us in our facility or in the community. I would ask everyone to please trust the science, trust the facts, and know that we're here to fulfill our mission and to help our veterans to improve their well-being of their life.
There you go. I know you're trying to show me your muscles, but
I ain't got much
we
muscle.
have got to just roll this up here.
We get them enrolled and we give them their vaccine, and then we tell them about all the different services that are available to them. It's just full circle, and it feels nice that veterans are coming to us and seeing what we can offer.
You didn't even feel it. That's the way we like them.
Universally, as an organization, and certainly in Montana, it's kind of changed our culture and brought everybody closer together.
We've been able to expand care out of the main facility into these community-based outpatient clinics, and that's really helped to improve our customer satisfaction.
We have to show them that we deliver the best care, and we have to convince them that even though they could go to the private sector, they should choose us because we do it better. That conversation that you have with a veteran about the why to come here is so important. If you said to the veteran, the community does this well, I think that maybe it would serve you better to go to the community for this, but for this, we're so much better than the community. Our quality metrics are outstanding in this area, and your best option would be to come to us. I mean, think about your own provider. They tell you something, you're gonna believe it. I do, without question, because you've got that trust.
I think that this has illustrated that the VA is a very powerful force. That's a very it's a national resource, in my opinion, and I think that again, through the actions of the VA, not the words, but the actions of what the VA has done, I think that the public sees us in a different light.
If you're a veteran eligible for care in Visit 19, I can assure you, you'll receive the best possible health care. We provide care second to none, and the pandemic proved that. We've always provided outstanding care, but the heroism of our employees in the manner in which they dealt with and still do deal with the COVID pandemic, I don't know why you would want to get care anywhere else.